Our guest today is Brian Parent, president of Families First. Brian, thanks for joining us today.
You're welcome. Thanks for having me.
How are you and your family doing during this pandemic?
Well, I'm sure like most families, we've had to readjust and change, but we're spending a good deal more time on the phone with our kids and using Skype and FaceTime and everything a lot more than normal. We did, my mother's 86, and on the weekend, my brothers and I and our wives all FaceTimed her together, and that was a bit of a mess at first, but Mom got to handle it pretty good. She's learned a lot on her little tablet in the time that she's had it.
Oh, that's terrific. It's always good to get together, even if it's just visually.
Visually is important. Visually is more important than a phone call, I believe.
I totally agree with you, totally. How has COVID-19 affected you and the operation at Families First?
Well, I mean, we've had, like most all businesses, we've had to make a number of changes. The businesses that are still providing services to the public to not only protect obviously the consumer, but also to protect our team, to make sure that we can always still be here to provide services. So one of the big changes that we made in the beginning is really just getting rid of our suits and getting into what I'm wearing right here is scrub clothes that we can throw in a wash easily and not have to bring our wool clothes or our cotton clothes home to our families. We're able to wash these out clean every night and get ready for the next day again. That was an important first step, but then we also took the time for the first 4 weeks. We separated our team into two completely different teams, and one of them we put them off for two weeks just to stay home and be safe, to self-isolate for 2 weeks. And then the other team just stayed in, and we worked right through the next 2 weeks. And then that portion of the team went home and they self-isolated for 2 weeks. Now we've just come to the end of that time, and now we're starting to bring everybody back into the environment, knowing that we're all certainly healthy, and we're trying to change our shifts so that we're not all kind of on top of each other either, right? So we've moved people out to different locations so that we can continue to stay separate from each other. So by separating our team, it's better for all of us to keep us healthy, and it's certainly better for the consumer. So for the families that we're serving, things have changed a lot also, just in the way that we make funeral arrangements, where we used to gather with 8 or 10 family members. Now we're in person, we're only allowing 2 people to come in to make funeral arrangements, but we are bringing the rest of them in via Skype, Zoom, or whatever medium that's good for them.
What you're talking about that, what are some of the procedures in place for the family of the deceased, for the visitors coming, and and how your staff handles them coming in?
Yeah. So the first thing we did at all of our locations is made sure that for those that had multiple entrances, we changed so that we only had one entrance into each of the buildings. And at that entrance, we're doing screening questions. We even take temperature, like we take the temperature of our team every day. Everybody does a temperature first thing as they walk in the morning. And the other thing that we're doing is when we're greeting friends coming in, if they're healthcare workers, then we might be doing a little bit more screening. We'll see if they'll voluntarily take their temperature. We're offering masks to anyone that doesn't have one. If they're coming in for a visitation, if they're coming in to make funeral arrangements, again, we're requiring them to wear masks. So it does change our environment a little bit. That doesn't mean that we're doing a lot of family visitations, and we are doing some public visitations, but by appointment.
How difficult is it for, it's difficult at any time, but how difficult is it for a grieving family to have closure and that support during this pandemic?
Well, I mean, I'm a bit of a believer that you don't truly get closure from a funeral anyways. What we're looking for really is confirmation that the person has died. And I would say that that's far more difficult now than what it was, because many times they're not at their bedside, and they haven't been at their bedside for 4 or 6, or in some cases 8 or 10 weeks now. And so to simply have the person buried or cremated certainly does not work. They need to have some confirmation that the person has died. So the visitation time for family and or friends by invitation has become more important than ever before for families. It's hard for them to believe that somebody has died when they haven't been able to be at their bedside.
It's a very difficult time. Is there any concerns for the safety of your staff if the deceased died of COVID-19?
Well, I mean, we have to take universal precautions in all situations. You know, if the cause of death for the deceased person is COVID-19, we use probably a little bit more personal protective equipment than we have in the past. But the reality is that what we want to do is to bring their loved one into our care, and even if it's COVID-19, do the embalming and preparation. Embalming and preparation does allow for a significant disinfection of the body, so that we don't have to worry about the transition of the disease from the deceased to our team at that point. We're still not recommending that they're touching the deceased, but they have been thoroughly disinfected, cleaned, bathed, and washed, and we're not worried about a respiratory issue because obviously the person is deceased.
Is there, with visitation, is there limits of number of people and how you bring them in?
So the Ontario government has limited funeral homes to the maximum of 10 persons in our building. So what we've done, because we constantly have families coming in and out, making arrangements or doing something, so we've, whether there's 2 people in for arrangements, 2 people in to maybe pre-plan, then if our building can only hold 10, we have to figure out what are we doing for visitation. So our visitation is 6 people. And sometimes you might have, you know, the spouse or one of the older children stay there through the entire visitation and just have 4 people or 3 people in and out by appointment. So it really depends on the needs of the family. Every situation is different and unique in itself. So when we talk to the family, we normally start to understand, you know, what their needs are and what we need to do to accomplish their needs, and to make sure that all of their immediate family and or friends can have an opportunity to come in and meet them if they wish.
There's more discussions about future memorials. Can you tell us a little bit about that?
Yeah, most all of our families are planning future memorials, public memorials. They want the support of friends. Well, we've been able to bring the friends in, you know, via Skype and Zoom. It's still, they're not there for that big hug, right? They're not getting that big hug that they really need. And so they are planning memorial services. Some already have set dates. They looked at birth dates and so forth out into the future that we think might be practical dates. But all of the dates that we're looking at are subject to change. But this is a good opportunity for them now to take time to make plans for the memorial, that maybe to do things that they might not have had time to organize before.
Yeah, it's a very, you know, I was speaking to someone else and we were talking about COVID-19, and the world still goes on, and you know,
it does.
We still have to continue to support each other, and you know, it's especially difficult during these difficult times. Do you foresee any of the procedures that you've put in place changing in the future, maybe when there's a vaccine or pandemic is over, or how do you feel about it?
I think we'd all like to see a return to normalcy, but what will the new normalcy look like?
Yeah.
Will always be a question, right? You know, certainly if you can eradicate a disease, then everything will go back to, you know, what things were 10 months ago. But what is the point we get to eradication, right? I believe that what we're going to see is, you know, a slow release of restrictions that allow us to bring more and more people in. So when this first started, we were groups of 50, and now we're down to groups of 10. You know, maybe we'll see an easing back and allowing us to 25, 30, or maybe even back to 50 again. Our visitation rooms are large enough, if we're putting multiple rooms together, to easily be able to physically distance people in a large room and be able to have a service. And I think that if we all start to, you know, when we're in groups like that, if we all start to wear masks, that will be a big help. And so I guess it really depends on where the provincial government is, what they see as being health. healthy and what they see as being safe for the public. And we have to be safe first. I think that's the most important thing. And once we can safely do that, then sure, everyone's going to want to return and everyone's going to want to gather. And let's hope we can get back to that hug. I don't think I want to live in a world that doesn't hug.
I totally agree. I totally agree. Brian, last question. What are you looking forward to once the pandemic is over?
Well, even if it eases a little bit, I'm going to get those golf clubs out of the basement and dust them off. But I think probably the thing that I would really look forward to the most is getting together with friends and family. I think I absolutely, especially with talking to Mom and my brothers this weekend, all at a distance, I really miss all of us being able to get together for Mother's Day and to enjoy each other's company. I miss being face to face. I miss being face to face with a lot of our friends. We have did with the exception of this weekend, a Friday night Zoom almost since the beginning, where we all just kind of log on and have a few drinks and have a bit of a conversation. And that's been great, but we need some physical presence. And that's what I look forward to, some good touch tones of being right in the same room with friends.
That's terrific. Well, Brian, thanks for your time today. We really appreciate it. We appreciate everything that you and your staff do during some very difficult times for families across Windsor and Essex County. So thank you. Please stay safe and stay well.
We will. And if there's any opportunity for me also to say here, one of the things that has been really great in Essex County is that the hospitals, the administration, the nurses and the doctors, the city of Windsor have actually on our side of the street have really worked closely together to be able to help facilitate things and make a lot of what we do a lot easier. And my thanks goes out to them for being so well organized and understanding of what our needs are.
Thanks, Brian. That was Brian Parent, president of Families First. And as Brian just said, this is Nurses Week, so we can't give them a hug. Maybe we'll give them a thumbs up to all the nurses working and trying to keep us all safe.